The question is that the motion be agreed to. I call
Mr.
Porter
Speaker.
Williams.
Thank you, Mr. Speaker. As a member of the Health Select Committee, it was an interesting, if sometimes somewhat confronting bill to work on in the Select Committee, and we had lots of robust discussions about detaining people and the loss of freedom and the like. But it was I think as a committee we got to a really good place. It was lots of robust conversations, and I think that the legislation that we came out with is in good shape. Mr. Speaker, addictions, particularly severe addictions that we are hoping to address with this piece of legislation, potentially life-ending, and that's where this particular legislation is pitched at people for whom their addictions are so consuming and so overwhelming that they are unable on their own to get the kinds of treatment that they need to actually save their lives or to actually stop them from being at risk of harming others significantly. So we're talking about a small but quite a significant group of people for whom, as the Honourable Peter Dunn has mentioned, for whom they've already been significant users of health services in an attempt to deal with their addictions. And they're often people who have not engaged with their community or with their whānau because they've really used their social capital up with the people that can support them, and they are in a position where they need significant amounts of care and support. But we did have lots of conversation about the fact that we are looking to actually take people compulsorily into treatment, undergoing treatment, and you don't do that lightly. So we had to have a look at the mechanisms that are already in place to support people around compulsory treatment, and of course we looked to mental health services that have that mechanism, and what could we use from that environment to support people with severe addictions. And there's often a crossover between the groups, between those who have severe addictions and those who have mental health conditions, and there was some correlation between how we could work that out. But it's not an insignificant thing to take someone's freedom away and then compel them to undergo treatment. So the whole discussion around compulsory versus voluntary treatment was one that was quite interesting, and I know that for many in the past, many with addictions, we've relied as a sector really on people to acknowledge that they have a problem and then to seek the support from treatment services. But in this case, their addictions are so severe that it is in our interests as a society to ensure that they are compelled into treatment, and for some it's their last hope. But this is not about the provision of wet houses, which is a mechanism that some jurisdictions use, where you can actually help somebody manage their addiction while they still use the substance. This is actually about making somebody stop using through the use of medication and treatment, and it actually is the last ditch in getting them to stop using before they actually potentially harm themselves fatally. We had a lot of discussion about, and it was raised by one of the submitters, about the types of facilities that might be used to provide this support, because currently I think we have about 3 facilities in this country that could tomorrow provide this kind of care, but we know that more is needed, and that there are a range of organisations and facilities which could be, if they were resourced appropriately, do the work, conduct the work. And one of the submitters to the Select Committee, in fact it was the Human Rights Commission, did make the point that they are mindful that often the behaviour of a person who is using substances means that they may actually be held in a police cell or or some such. And the Human Rights Commission were concerned that that does not become a default setting for people with severe substance abuse. And we had quite a robust discussion about that. So we are very clear in the Select Committee about ensuring that wider disability facilities, that the wider range of mental health facilities also be provided with the resources to conduct this treatment. So hopefully we have addressed that concern by the Human Rights Commission. One of the other things we considered was the ability for the children of patients who go into this type of facility, that they are notified appropriately that that their loved one is in the facility, and the type of treatment that they are going to receive. So we are required to provide them with a range of information, details on where they're located, the type of treatment they're going to receive, the length of time, and that provides them with some oversight from outside of the facility. But the other thing that we considered was the role of the district inspectors. District inspectors are a role that's well known within the mental health sector as being the key oversight to ensure that the rights of the patient are upheld. So we did, in Select Committee, spend some time ensuring that that role was well defined, and that access to the district inspector for the patient occurred within a 14-day period, so that they could be clear that they could have their rights ensured. Mr. Speaker, there are clauses within the legislation that allow patients to consult with approved specialists, and they're able to get second opinions. There were some submitters that commented on the resource to be able to deliver this particular service, and there are some key components that we do need to address before this service is actually able to be delivered competently, and that is about ensuring that we have enough professionals with the right types of skills, the right types of ability, and that we have them in sufficient numbers, and that the facilities to provide the work are available. The Select Committee had a discussion on how long it would be, how long is an appropriate treatment period, and we did talk about having treatment that was long enough to ensure that you provided the right kind of care, but not so long that it became a matter of detention. So that was a very robust discussion. But I just want to quote from some of the Select Committee, from some of the submitters that submitted to the Select Committee. The Canterbury Alcohol and Drug Consumer Leadership Group made the comment that that they were concerned about the threshold for an individual to meet the criteria for compulsory treatment would be set too low, and they felt that they needed the criteria of a diagnosis to be set high enough for compulsory treatment, and I think we considered that fully. The DAPANs made the comment that that they were hoping for some work in terms of ensuring stronger concepts of recovery, that there were provisions for the consideration of cultural needs within the treatment of people with severe substance addictions, and that the inclusion of family and whānau and other support people in decision-making processes be included. Just to finish, Mr. Speaker, I just want to go back to the Human Rights Commission and just quote from their one of their submissions. The way that the legislation is implemented in practice will be the most important, and I think that we all agree with that, and this will depend in large degree on the availability of suitable funding, treatment centres and experienced staff. And we all agree that inadequate resourcing could derail this, but I think that in terms of legislation we've gotten to a good place, and we are happy to support this bill.